She wants a man.
How the hell could she have loved a manipulative son of a bitch like you?
Maybe she saw something in me, something she doesn't get from you.
I'm not an ass.
Maybe she wanted an ass. She obviously did once.
Either he goes or I go.
I think that's the kind of thing you can just turn off.
Get him out of here!
Oh, this is an ancient discussion and reminds me of a Quora response I came across a few years back. The author argued that bad boys do succeed early in life. Very excited to be reacting to House MD Season 2, Episode 6, Spin. On this channel, we are reacting to all 177 House episodes, and this will be episode 54. Let's see if I can get the diagnosis before House does as a doctor working in London.
Here they come! Go, Jack! Yeah! He doesn't look so good.
I love how the son just puffs on an inhaler at the end like, I guess I'm missing the Fortnite tournament tonight. So the dad was exercising, is a cyclist, the episode title is Spin. So the obvious answer is that he's got rhabdomyolysis from overexertion, which means the muscles breaking down and causing high potassium in the blood. Those concentrations can mess up the electrical activity of the heart, causing it to go in a funny rhythm and then the patient to collapse. This reminds me of when I saw a 31-year-old male who's doing the London Marathon a few weeks back. He was on mile 25 with just 1 mile left and collapsed pretty much exactly like this. Next thing he knew, he was awake in a bed attached to machines with lines coming out of him. He had rhabdomyolysis. Thankfully recovered fully from the injury, but not quite from having just 1 mile left in the race before finishing. So rhabdomyolysis is the obvious answer, but it could be anything. Cyclists could be in countryside areas bitten by ticks and gotten Lyme disease, or Spin could mean he has a metabolic disease that affects the body's energy cycles and it manifests on extreme exertion like hypokalemic periodic paralysis, or maybe they have mold at home triggering his son's asthma and causing a lung disease called hypersensitivity pneumonitis in the dad, or he's just taking roids. Give us more clues, Sherlock.
Just admitted a world-class cyclist.
He's not denying the drugs.
I do straight blood doping. I usually sleep in a hyperbaric chamber. I've been pumping up electrolytes with an IV drip, anabolic herbal supplements, amphetamines, and diuretics.
Whoa. If this patient does any more drugs, then House should sell his urine on the black market to pay for his medical negligence bills. So which one can cause collapse? We've got blood doping, amphetamines, anabolic steroids, hyperbaric chamber, which is 100% oxygen, IV electrolyte drip, herbal supplements. This is going to be fun. But before we can answer that, what is blood doping? Basically, elite athletes expand their blood volume to improve their performance using not so savory methods. You see, the more red cells you have, the more oxygen your blood cells can carry and the better you perform. There are two main methods of doping. One is by injecting a drug called erythropoietin, or EPO, which is naturally produced in the body and tells your bone marrow to produce more red cells. The other is by extracting your own blood and then storing it for later to transfuse yourself before a competition. But isn't there a third way to expand red cell volume? Yes, there is. High altitude training, which can have very similar effects to blood doping, raising hemoglobin and red cell volume in the blood. So how can the World Anti-Doping Association tell the difference between altitude training and blood doping? They monitor changes in the blood composition with multiple tests over time. See, athletes have to report their whereabouts coming up to a race so that any altitude training is declared. And altitude training changes blood composition slowly and gradually. So any rapid, suspicious fluctuations in blood composition then would trigger an investigation. But according to this process, between 1 and 2% of athletes are actually doping, but when you run truly anonymized surveys, like with Ulrich and colleagues in 2018, the true figure is that 44% of athletes are doping. So there's definitely some work to be done on detecting athletes that aren't playing fair, especially since it then becomes almost mandatory to dope if you're gonna want to compete at the highest level, or you could just move to the mountains. My prediction, as the episode is called Spin, is that usually the athlete refuses doing drugs and it's drugs. Now the athlete has admitted doing drugs, so it won't be drugs. It must be something else, so let's find out more.
We have a list of possible causes for one symptom. Respiratory distress.
All it takes is one slip of the needle to cause an air embolus.
Get a VQ scan and check his veins for bubbles.
House just said air is stopping him from breathing air. He liked that differential because it was the most ironic. I had to explain what irony was recently to a European friend with English as their second language. It's actually quite difficult, so I needed to come up with a few examples. It's like when a police station gets robbed, or a doctor gets sick, or when you write about how tired you are of social media on social media. So their primary diagnosis now is air embolism because of how many times a day this patient is injecting himself. It's important to be extremely careful with air bubbles, and we'll always want to remove them. The truth is though that you need at least 20 mils of air injected into the venous system before you start getting symptoms. In the arterial system it's much less, with only 2 mils required because it's actually providing oxygenation for vital organs. The scenario where we would typically see an air embolism in healthcare is in divers who've resurfaced too quickly. That's because as atmospheric pressure decreases and the diver resurfaces, gases like nitrogen begin to expand and clog up blood vessels. So treatment for that is a rapid recompression using a hyperbaric oxygen chamber, which this guy is using. That increases the atmospheric pressure again, reducing the size of the bubbles, and the diver is slowly brought back to the atmospheric pressure, allowing the body to acclimatize. Even if they do find a bubble though, I doubt it's the cause of this patient's symptoms. We do know a few things about this patient, like all his investigations were normal, including tox screen and chest CT, yet he's still breathless. So what else could this be with what we know so far? So if it's pulmonary, it could be asthma or very early interstitial lung disease. Since to detect that, we need a high resolution CT rather than the bog standard one the team has done. If it were cardiac, it could be angina due to blockages in the coronary arteries. A very spicy House-esque diagnosis here could be pericarditis, which we do see in young athletes and would cause exertional breathlessness. It's inflammation in the sac around the heart and can be caused by viruses and autoimmune diseases. I'm gonna use my first guess on pericarditis here since I get 3. That is number 1. So if it was psychiatric causing his breathlessness, then it could be anxiety or panic attacks as well. Could also be a boatload of other things, but for now I definitely want to do usual blood tests, check for diabetes, high cholesterol and blood counts as well. Would also want an echo at this point to check his heart and then take it from there.
You were right. We should do a Swan-Ganz catheterization.
If I can just find the little bugger, should be able to suck it out.
It was an air embolism. What? Still doesn't mean that's what's causing his symptoms. In real life, of course, that would be it, but House has more twists and turns than a snake eating an earthworm. Also, I love how Chase is doing a sterile procedure with no drapes, no surgical gown, no mask. He must have realized that the only organism that doesn't find him attractive is bacteria. Another important thing to note is that Swan-Ganz is for detecting, not sucking. Even if it was sucking though, then he would need a full-on interventional radiology suite to do this procedure, not casually on the ward like he is. The equivalent would be like driving a 16-wheeler on the highway, blindfolded. Does make for very interesting television though. So when is this Swan-Ganz catheter actually useful? So in critical care, you can monitor pulmonary artery pressures in conditions like pulmonary hypertension or acute cardiogenic shock. What's really interesting is how the waveform changes as the catheter is being inserted based on where it actually goes. The procedure starts by inserting the catheter into the subclavian vein. The first target is the right atrium, which is the top right chamber of the heart. Now, in theory, the waveform when the catheter is at that point, you should be able to see without even touching the patient. How? By looking at the jugular vein, because there are no valves between the right atrium and the jugular vein. That means that there's a column of blood sitting there that rises and falls with the right heart pressure. Now, reading that just from the neck is an extremely tough skill to master, but in theory helps you to identify problems like atrial fibrillation or cardiac tamponade when blood builds up around the heart. You can also see how the waves change as the catheter gets into the right ventricle, then up to the pulmonary artery and its final destination of the pulmonary capillary as well. Pretty cool stuff.
Legs feel weak.
Got it.
Jeff?
You alright?
Oh, this is getting spicy. We've got some more symptoms now to work with. First, we have leg weakness, difficulty swallowing, and arm weakness that came on suddenly. Makes me think of a stroke. A stroke can be caused because of a bleed or a clot. About 9 in 10 are clots, which is why they're generally treated with blood thinners. So where could this clot have come from? Number one place I would suspect in him could be the heart from infective endocarditis. We also know that blood doping increases the risk of strokes itself because of the thicker blood, but that would be way too easy. Could also be something called a paradoxical embolism if he's got an open connection between the right heart and the left heart, and the clot went up to his leg through a hole in his heart, then up into his brain. That would be a crazy diagnosis. It seems like everything for now is pointing to his heart. I hope they do some cardiac investigations soon before they start prodding him with more stuff, or it could just be something else altogether. Let's find out more.
Muscle fatigue in his neck and jaw. He's obviously got something worse than an air embolus. His legs were tired too.
Lupus or polymyositis? Full blood workup, including ANA for lupus. And get a muscle biopsy.
Lupus? Could this be the episode we've been waiting for? I'm not convinced. Now, what was displayed looked more like sudden onset muscle weakness, but let's go with what they're describing, which is muscle fatigue in the neck, jaw, and legs. They've suggested polymyositis, but the onset wouldn't be this quick. My feeling here with what they've described, and my second diagnostic guess, would be myasthenia gravis. Now that is a spicy diagnosis with a very interesting mechanism. You see, all muscle contraction requires a neurotransmitter called acetylcholine to activate the receptor on the other side of a neuromuscular junction. That causes muscle contraction. In myasthenia gravis, there are antibodies against the receptors that detect that acetylcholine, which means your muscles fatigue very easily. The initial contractions work well as all the receptors are free, but then the muscles fatigue very easily once the receptors are saturated and their capacity reduces. It first presents in patients between around 20 and 40, and it classically affects females, but only at a 2-to-1 ratio. Treatment is with a tablet called pyridostigmine, which helps the acetylcholine stay in that neuromuscular junction for longer by blocking the enzyme that breaks it down. That's 2 of my first guesses down, only 1 to go. Let's see if I'm right.
When am I gonna stop being angry?
Not today. When it happened to me, Stacy was great. Stacy, she didn't have to wait, right? She didn't get married to be a nursemaid.
She didn't get married to be a nursemaid? Then why do her partners keep getting sick? First, House with his leg. Now Mark with a perforia. Stacy needs to be isolated. Next she'll kiss the pharmacist and he'll lose a lung. Now it seems like House is trying to plant the seeds of guilt within Mark that will grow into one of those beautiful trees that sabotages your house's foundations. So when you lean too hard on one wall, the whole thing topples over and all that's left in the rubble is your broken relationship, a moldy piece of bread, and an indestructible vibrator. That's when House swoops in and earns his name by rehousing Mark's wife somewhere near trees with roots shallower than a Dr. Mike reaction video. If anyone adapts that into an animated film, then remember me when you're famous. Since we're on the topic of dangerous love, I've got a question for you smart people. Are STIs more likely to get transmitted from males to females or vice versa? Why? Answers down below.
She wants a man.
How the hell could she have loved a manipulative son of a bitch like you?
Maybe she saw something in me, something she doesn't get from you.
I'm not an ass.
Maybe she wanted an ass. She obviously did once.
Either he goes or I go.
I think that's the kind of thing you can just turn off.
Get him out of here!
Oh, this is an ancient discussion and reminds me of a Quora response I came across a few years back. The author argued that bad boys do succeed earlier in life. That's because of their indifference to authority in life, which ends up leading them not very far. He then argues that he was one of those bad boys who could walk into a room with dozens of beautiful women and talk to them with unshakable confidence. What was the trick? He was married. He didn't care about what the outcome was. He had no romantic agenda. The advice he gave was that even if you're single, remember that you're just socializing. Be normal, friendly, assume everyone has pre-rejected you and you're just hanging out. The indifference leads to confidence and confidence unlocks attraction. Funny how House still has that indifference toward authority, but it's tolerated because he's brilliant. That tension makes this show so fun to watch. Great writing. Let's get some more diagnostic clues. My money's still on Myasthenia Gravis.
He can barely move his arms or legs.
He's artificially raising his red blood count, so why isn't he red?
If that's true, his white cells are up too, which would point to some kind of infection.
He could have encephalitis. So, get a lumbar puncture.
Infection from a normal white cell count. Here's a thought. Do the creatine kinase blood test as a marker of muscle breakdown. Get an EMG and nerve conduction studies to check muscle responses to nerve impulses and how healthy the nerves themselves are. We know the muscle biopsy is normal, so now we need to check if the nerves are too. Then be my guest and poke his spine for as many Hail Mary lumbar punctures as you like. Now the team have said this isn't paralysis or fatigability. Now it's generalized weakness. We know the muscle biopsy and lupus screen are negative. That with infection makes me wonder about something we thought was eradicated, polio. It was actually eliminated in the late 70s due to vaccination, but there have been drops in rates of immunization recently, which has led to a recurrence in the US. In West London, we actually had similar experiences recently with the polio virus being found during sewage analysis. That led to a massive campaign to vaccinate children in West London to give them extra support against it. With polio though, we would expect muscle biopsy changes, but Cameron said she biopsied the thigh, so maybe she wasn't looking for it in the right place. They could test for it in the stool, throat, the blood for antibodies, and in this lumbar puncture, but they would need to know what to look for in the first place. Another potential explanation would be anabolic androgenic steroid-induced myopathy. We know steroids cause muscle breakdown in some cases, but these are usually glucocorticoid steroids and not anabolic steroids, although they have on rare occasion been shown to actually do that as well. If House loves the most ironic diagnosis, then anabolic steroids would definitely tick that box. Now, if you think this content is like anabolic steroids for your neurons, then check out the channel membership. You get early access to new videos, priority reply to comments, inclusion in private polls, and suggesting a series and episode for me to react to. The first 30 members get a chance to win a 1 hour one-on-one tutor session with me, and there are just 5 spots left, so make sure to secure your spot by pressing join now.
I'm Jeff Forster's manager. I hear you've been raising funds for your nuclear medicine department.
That check to the nuclear medicine department is like colonic irrigation improving concentration. It will never get there, it's full of crap, and in the wrong hands has capacity for producing explosions. What it does remind me of is an insane story of US healthcare fraud I heard about recently. There were almost 80 people charged with stealing $2.5 billion from patients, insurance companies, and US government funds. So how did they actually do it? The scam was masqueraded as a telemedicine service that was basically a national telemarketing op to target elderly and disabled people and upsell them on medical products that they didn't need. Actual telemedicine companies would then get commission and bribes for seeing those patients and making fraudulent orders for orthotic devices which could be claimed from Medicaid. The company was even sold after the scam was set up, and the new owners just decided to continue it. Madness. The action also included almost $400 million in fraudulent claims for prescription drugs, part of which was reselling illegally diverted HIV medication. Some of these had been bought from patients before being reconsumed and were of varying quality with broken pills, pebbles, and even the wrong meds inside. All of these were repackaged and sold off again to pharmacies and patients. One of the people running this scheme used this illegally earned money to buy a $280,000 Lambo, a $200,000 Mercedes, and 3 boats. Now they're facing criminal charges from the Justice Department, and I'm glad to hear people like this are being caught. It does make you wonder though, if these are the ones that have been found, how many are out running similar schemes and still undetected? Stay vigilant, my people. Now we've seen the situation here, but in real life, if someone wrote us a check like that, we'd have to decline it. Generally, we accept gifts freely only under the value of around $30.
My arm's still funny.
The stats are dropping. He's a respiratory arrest.
The white count's still the same, but the red count's fallen to 29%.
A respiratory arrest, not a cardiac arrest. That's unique, but probably from a lack of hemoglobin, it seems. We also don't measure red count in percentage usually, but 29% sounds like not a lot, so let's go with that. He doesn't seem to be overly bleeding anywhere, but it's strange that his white cell count is still up, unless they're trying to indicate that he still has an infection, and that's why the white cell is high but the red cell count is low. So other than bleeding, what else can cause anemia? Bone marrow suppression. In the context of infections and muscle weakness, that makes me wonder about a virus called parvovirus B19 that could cause all the patient's symptoms, is rare enough to be a spicy one for house, and is reversible. That is my third guess. If it is that, then he'll now need transfusions to keep his red cell levels up until the body kills the virus. This just got very interesting.
I think I should start smoking again. The symptoms started as soon as I quit.
Diarrhea.
10 or 12 times a day. It's really embarrassing. I'm a flight attendant and...
You still want to jump me, so you don't care whose marriage is
Listen, I could get my rocks off anytime I want. What I don't seem to be able to do is my job without you hanging over my shoulder.
Oh, see House's plan. He just wants to annoy Stacy so much that she leaves, since she keeps giving him annoying paperwork for useless things like stopping his medical license being taken away. Such a pencil pusher. Now the clinic patient almost definitely has ulcerative colitis, which is a type of autoimmune condition that affects your bowel. It's one of the only conditions that improves with smoking and causes massive amounts of diarrhea, usually with mucus. This is going to blow your mind, but there's also evidence that smoking lowers your risk of Parkinson's disease by 60% and endometrial cancer by 35%. I wouldn't sell your house to buy tobacco shares just yet though. The other cardiovascular respiratory cancer risks with smoking definitely outweigh any of those benefits. So even if someone has ulcerative colitis, and this patient probably does, we would advise them to stop smoking, and any relapses would be controlled with meds that won't wreck his health like cigarettes can. As a smoker, even if you get lucky and avoid the cancers, then respiratory disease, if you smoke enough, is almost an inevitability. That means needing constant inhalers, getting frequent infections, and always feeling breathless from a condition called COPD. Definitely not worth it.
You're being poisoned.
By gum?
Sugarless gum uses sorbitol as a sweetener. We use sorbitol as a laxative.
Seems like I was about as accurate on ulcerative colitis as Trump with COVID.
Looks like by April, you know, in theory, when it gets a little warmer, it miraculously goes away.
Sorbitol acts as a laxative as it draws water into the bowel by increasing osmotic pressure. It can also cause bloating, reduced absorption, and weight loss. Reminds me of a case I read on a 59-year-old patient who had non-bloody diarrhea for a year with abdominal cramps. She had self-diagnosed with IBS, but the diets weren't working, and she had tried a low FODMAP diet, an elemental diet, and a specific carbohydrate diet. Some investigations revealed she had a parasite in her gut called blastocystis. This was treated, but her symptoms didn't improve. Then she had a camera test in the stomach, colonoscopy, a trial of pancreatic enzymes. Nothing worked. Eventually they did an x-ray and found gas in the bowel loops, so did a thorough diet assessment and found out she was chewing 1 pack of artificially sweetened gum a day. As soon as she stopped the gum, all symptoms resolved within 48 hours. Madness.
He doesn't have cancer. Biopsy shows he's got pure red cell aplasia.
You've got a leak. The press is all over the Jeff Forster story.
I'm pulling your phone records.
Am I supposed to practice medicine with a lawyer sitting on my shoulder?
Responsibly.
You know I can't do that.
Oh, Cameron went ahead and leaked the story because she felt it was unfair that children idolized this sports person when he was cheating. What's even more interesting is that they've confirmed red cell aplasia on a bone marrow biopsy, which means that the parvovirus theory just got way more likely. It's quite an interesting virus because the same virus can cause different conditions in different people. In children, it can cause erythema infectiosum, also known as slapped cheek syndrome. In adults, it can cause a type of arthritis that exactly mimics rheumatoid arthritis, called an acute symmetric polyarthritis. In immunosuppressed patients, it can cause the bone marrow to stop producing red cells, which is called aplastic crisis. So how might Jeff have made himself immunosuppressed? There have been reports of anabolic steroids doing it, especially with high doses, causing reduced antibody production and white cell activation in response to invading pathogens. There's also been some evidence of anabolic steroids reducing the distress signal that your immune system sends out in response to an invading pathogen as well. But it just being with the steroids doesn't make for a great story. Maybe there's something else hiding behind this if it actually is a parvovirus B19 infection. Let's find out.
How does cancer make the guy look bad? He's on EPO. You gotta talk.
What the hell are you doing?
He'll be fine. Sort of.
He doesn't do EPO.
Does she handle any of your injections?
You think I'm giving it to him? Test him.
What? Don't tell me he's on EPO and this isn't parvovirus. What she's suggesting wouldn't be helpful because tests for EPO are not great anyways. It's eliminated in the blood and urine after 3 days of being administered, and so it almost certainly wouldn't be detectable after that. That is quite a short elimination period, especially compared to other things like cannabis, which is detectable in the blood for 2 weeks after use, or benzodiazepines, which are in urine for 3 to 6 weeks. So question for you smart people, what test can show cannabis use for longer than blood testing, and how long is it detectable for? Answers down below.
I sure hope that EPO is not one of those drugs that's undetectable after 6 hours. Take her cell phone, push the redial button.
If you come back from cancer, those sponsors will be all over you.
You're fired.
If this episode has any more twists, I'm going to need pills for travel sickness. House has convinced Jeff his manager is giving him EPO. She's declining, but admits that she leaked a cancer story to the press so they could all marvel at his recovery after and shower him with sponsorship money. Now we know why so many artists have medical conditions. Also, House mentioned EPO is undetectable after 6 hours. Even with the tech available during shooting, it was still fully detectable at least 24 hours after, so not quite accurate there. But if it meant House had a reason to snatch her phone, then I'm all for it. Hopefully this was just a mini epiphany though, because if House is right about EPO, then we've just found the cure for global warming. Just pump all the CO2 in the space between my ears.
You're gonna kill him.
His red blood cell count plummeted to 16%.
He needed a transfusion. Go forth and scan his neck.
$50 says we find something.
The neck! While we're at it, let's scan his right fourth toe and prostate as well. Throw in a whole body MRI for good measure. You may think that sounds like a good idea, but on average, if you did a whole body MRI on anyone, you would find 3 incidentalomas of no significance, kind of like the air embolism, but more solid. So why does House think the neck could be relevant? Head and neck cancers can cause anemia and EPO resistance. The thyroid gland is also in the neck, and low thyroid levels could cause the symptoms, but that would show up on the blood test. Or maybe he's looking for neck nodes that could indicate HIV from all the injecting. That's why he's immunosuppressed, which led to the parvovirus aplastic crisis. If that's it, I'll be very excited.
We found a thymoma.
Thymomas usually present in the chest.
All we've done since he checked in is look at his chest. Up to half of patients with chronic PRCA have a thymoma. I've always wanted to do this.
A thymoma! Oh, that is a very House diagnosis. We are now in an area so specialized that you need a team of subspecialists to manage it. There have only been a few cases of red cell aplasia related to thymoma, and generally it resolves by just cutting out the tumor. The cause of anemia isn't well understood, but the theory goes that there's problems with the immune system with abnormal T cells and antibodies to the cells that generate red cells, and antibodies to red cell precursors. Mainly it will be surgery to cut it out. I'm not sure what exactly House is holding. Could it be an injection of EPO to stimulate red cell production? Maybe that's why it's called spin, since cheating was actually the only way of the patient treating his condition. Great writing. Well done, Universal. Let's find out.
I'm not getting any better. Does that mean
You are healed. Rise and walk. Thymoma is a tumor in the thymus gland. He's a bit of a wimp, but he hangs with the tough guys. PRCA and an autoimmune disease called Myasthenia Gravis.
Myasthenia Gravis. That was my second guess. Yes, I'm taking that. Now that's like 10 diagnoses for me and about 44 for House. Is anyone keeping count? I hope I can catch him up, but these season 2 ones are getting very hard. The patient's symptoms resolved very quickly, so House must have given the first ever drug known to treat the condition called physostigmine. It's a drug isolated from the caliber bean, which was used as a poison and isolated by a guy called Percy Julian in 1935 after improving on a previous chemist's steps. The chemical from the purple bean acts like nerve gas, inducing hypersalivation, seizures, loss of control of the bladder and bowel, and eventually death when overdosed. But one person's poison is another person's treatment, as it helps to build up acetylcholine that's effects are deficient in myasthenia gravis. That's why our patient can now move his fingers, but that likely won't last very long. So they'll need to cut out the tumor to fix it for this patient. Physostigmine, though, it isn't actually being manufactured anymore, though, so it could also be a molecule that works in a similar way called edrophonium. Let's find out.
No EPO. Tensilon erases the symptoms of NG for 5 or 6 minutes.
I want to thank Dr. House and the excellent medical team here at Princeton Plainsboro.
The good news is I got the diagnosis. The bad news is we may need to think of another way to save the environment. Some interesting plot progression here as well. Cameron had a thing for her ex-husband's friend, but didn't go ahead and cheat. Wilson had a thing for someone else while he was married and did cheat. The patient now has a free pass to blood dope because of the aplasia. House figured out Stacy still loves him and hates him and is getting therapy for it, so he's probably going to pull her records to get the full gossip. Great episode, 8.5 out of 10 entertainment, 7 out of 10 accuracy, 8 out of 10 diagnosis. This episode was good, but doesn't make full sense unless you watch the previous one where House treats a famous doctor who has a strong difference of opinion right here.